Yeah,
like
it's
a
kind
year
of a
ago.
ghost town. In other places besides California, like in Arizona, Fry's is a grocery store.
Oh,
Same company, same logo, same everything, but it's a grocery store. Yeah. So anyway,
all right. I mean, personally, I mean, Fry's has a lot.
I just needed a Cat 6 cable, so I went and bought
Yeah.
a 15-foot long Cat 6 cable that I needed
Years
at home.
ago, Cyril was helping me build a computer like 5 years ago.
Yeah.
And the SSD drive didn't fit in the normal stock CD-ROM drive.
Right. Yeah.
port.
Slot.
You have to buy the adapter that will take up the whole space, and then the SSD drive mounts into that adapter, and then now it fills. But we didn't know that until we got the part in, and then so I had to go to the one in Burbank and buy the adapter. But I mean, they got everything there.
Yeah.
I mean, if you want to build, you're doing computer
They
stuff.
used to have everything there. I'm not sure they do anymore because the shelf that used to have computer cases on it,
Empty.
empty. And I remember I built several.
I'm surprised Amazon hasn't put them out of business.
I built several computers, by buying stuff at Fry's. I had a buddy who was, not a close friend, but a guy I knew, that he was one of those guys that had to be the first on his block to have everything, the latest, greatest, newest, and best.
Of course.
And so he'd always get rid of his old stuff. And so he'd sell motherboards to me for cheap, and he was meticulous. He always had the everything, the manuals and all that stuff, right? So he'd sell them to me for cheap, and I'd buy them, and they were much better than what I had. And then I'd go to Fry's and buy a case, because he'd keep his cases, because his cases were. And I'd go to Fry's and buy a case and stick the motherboard in it.
Yeah, you just buy one of those big like Corsair cases or something where you can put
a bunch of stuff in,
hard drives in it.
So
kind of like this big gaming tower.
All right, I'm supposed to be in class. It's 11:15, so.
All right, have fun.
All righty. Again, good luck with getting that truck. I should have 11 of us in class, I think. And I don't have 11 of us yet. I only have 1, 2, 3, 4, 5, 6, 7, including me. So we're short some people. Where is everybody? I'd blame the fact that they couldn't find the Zoom meeting thing, but you guys found it, so I guess that means everybody should have found it. We're getting closer. All right. Let's see who's here. Andrew's here. Anthony's here. Jeremy just got here. Edward's here. Javier's here. Jeremy's here. John's here. I'm taking a roll because we've been told that we have to make sure we take roll. Marissa's here. Maurice is here. And Ray's here. That's most of you. All right. So when last we spoke, we were talking about sort of the basic rules of constructing medical terminology, right? Words, how medical language happens, how you put it together, and then how you decipher it, how you define it, right? So some of the basic rules, it's usually a word root plus a suffix, less frequently a prefix. Prefix changes it, alters it, negates it, puts a number to it, some of those kinds of things. Suffixes do a little bit different to it. A word root plus a vowel is called a combining form. The combining form is used to add a suffix that does not begin with a vowel. If the suffix begins with a vowel, then you don't need to use a combining form. You just take the word root and add the suffix on the tail end of it. Or if you want to create a combined word, like gastrointestinal was the one they used, you always have to use a combining form. So gastro is the combining form, and intestinal, right? The AL suffix on intestinal, the AL is a sort of a suffix that just means referring to gastrointestinal distress, referring to distress in the gastrointestinal system. So hopefully that's all fairly clear. So what we get into next is talking about suffixes. So we're lecture 2. I don't think I got a recording of lecture 1, so I may go back and record it and post it for you guys. I think the lecture for, no, not your class, different class. So I may go back and re-record lecture 1 and post it so you guys have it as a reference. I don't have to do that. I might not get to it, but if I get to it, I'll post it, right? This is one of the things I when I talked to you guys last class about taking notes and stuff. One of the things that I mentioned is that a lot of students kind of stopped taking notes when they would have taken notes when I was lecturing live. And one of the things that I tried to explain to the other group, and then I'll mention it to you guys, is that when I used to lecture live, there wasn't a recording of me. And so people would take notes. I told the other class, and I'll tell you guys, I don't necessarily feel obliged to provide you with a recording because I am lecturing to you. Just like I'm lecturing to you now. So I lecture to you guys, so I don't necessarily feel like I have to provide you with a recording. And so with the other group, sometimes they got into some trouble because I forget to hit the record button and stuff wouldn't record. And then they would have sat through lecture without paying a lot of attention and thinking they'd be able to look at it later. And it wasn't there for later, so they'd run into trouble. So anyway, enough of the lecturing. Let's get to the lecture. So let's talk about suffixes. So suffix is a word element, obviously placed at the end of the word. It changes the meaning. And singular and plural, or used to denote part of speech. So types of suffixes, surgical suffixes, diagnostic, pathological and related, grammatical and diminutive, and singular and plural. So we'll add a suffix to the word root in order to make it either singular or plural. And it's not, it's Latin and Greek, and so it's not necessarily your typical way to form a plural form, but you should know how to do it correctly. So this is now when we start getting into the suffixes you kind of really need to know, that you'll be tested on, if you will. So ectomy, removal of, synthesis, a puncturing, surgical puncturing, if you will. Tripsy, a crushing, I think is how it's described. So, so the word root links a suffix that begins with a vowel. So, so gastritis, the word root is the word root is gastro. How do you pronounce it right without a vowel being on there? So that's why you have to add a vowel. So the combining form would be gastro, which is easy to pronounce. But gastritis, without the vowel on there, it's hard for me to even say the word gastro. So gastritis. So itis, right, is an example of the word root with a vowel, a suffix that begins with a vowel. And then gastroscopy. This is an example of a word root turned into a combining form because the suffix begins with a consonant. So gastroscopy. So what's an excision and a removal, right? What term? What's the word? Let's. You guys are a small enough group. Let me try something. You guys are a small group. So I used to be able to unmute you guys by choice. I could choose, but because of privacy issues, I am no longer allowed to unmute you guys. And I get it. I get why that is. Who knows what's going on in your background. But I'm going to assume not too much is going on in your background and you're a small enough group. I'm going to have you all unmute. I just clicked the ask to unmute button. So I'm going to ask you all to unmute so that when I ask questions, you guys can pipe in with answers. Let's see if I can. So excision or removal, what's the suffix?
Ectomy.
Ectomy. Yep, ectomy. Very good. Surgical puncture is what? Synthesis, right? Synthesis. A crushing.
Tripsy.
And separation, destruction, or loosening, which we didn't have yet, is lysis. Lysis, right? So you know you were right. Ectomy, synthesis, tripsy, and lysis. So the word that we used for tripsy a minute ago was lithotripsy. Anybody have any ideas on what litho is, or lith? What's a lith? Any ideas? No one?
Lith.
What's a monolith?
Structure.
What kind of a structure? What's a monolith? Wasn't there a monolith in 2001 Space Odyssey? I know that's all way before your time. Some of you may have watched it.
It's like a tall tower, like a tower, or
Well, it's like a big, tall stone structure,
okay.
right? Mono, a single column, if you will. Monolith, monos meaning one, which is a prefix we'll get to in the future. Lith being a stone structure, right? A big stone column is a monolith. So a lith is a stone. And in medical terms, a stone is like a kidney stone, a bladder stone, a gallstone. You know, you've heard those terms probably used, right? So kidney stones are crushed using a thing called a lithotripsy, or done through a procedure called lithotripsy, right? So crushing tripsy, so lithotripsy. So the word root there, lith, is stone, just to give you some future perspective. So excision removal, we just talked about those. Lysis, yeah, I don't know, give you any other synthesis. People have heard about an amniocentesis, right? Amnio, when a woman is pregnant and they take a long needle and they go into the amniotic sac and draw out some amniotic fluid and analyze it to look for the potential of birth defects and chromosomal issues and genetic issues and whatever, right? That procedure of drawing that fluid out is called an amniocentesis, right? So synthesis, it's a puncturing.
So synthesis is the removal of liquid, right?
No, synthesis is the puncturing process.
Oh, okay.
Arthrocentesis, if any of you who've played sports and had a knee injury and your knee got full of fluid and they withdrew the fluid, they call that an aspiration. They aspirate the fluid, right? That's technically called an arthrocentesis.
Oh, okay.
What's the shot that women this may be what you just spoke to, but there's a pain shot you can get
An epidural.
Yes, is that synthesis?
Epidural. Yeah, that's probably done with a dural synthesis, if you will, or an epidural synthesis. But an epidural anesthetic is epi is on top of, right? And dura is the stuff that surrounds your spinal cord. So epidural is what that's all about. They do is they put a numbing thing kind of around the dura, right near a nerve root, and create a numb area, if you will, so that when they're going through labor and delivery, it's not as painful. Okay. To break or a surgical fracture, classis. Anybody familiar with the history of the Reformation of the Church? Martin Luther and things like that, and icons, and they were called iconoclasts. You know what an iconoclast is in sort of the more vernacular pop culture colloquial terminology. What's an iconoclast? Anybody?
Not sure.
An iconoclast is someone that breaks icons, right? So back in the Reformation of the Church, they were worshiping. The belief was among certain factions in the Reformation that certain religious factions were worshiping icons, which they really weren't. They were worshiping the saint or the religious figure that the icon was meant to represent, but a lot of people thought it was worshiping the icons, and so and so they broke those icons, and they were called iconoclasts. Nowadays, in the kind of current thing, is somebody who's a real rebel, who's trying to topple the people in power, or the people who are held up as being so special in society, are those types of rebels are called iconoclasts, because the people who are held up in society are icons, if you will, and classed is to break, right? So I'm trying to think of another term. Anyway, well, it doesn't matter. Fixation, hexi. Not a heavily used word. A suture is a raphy or oriphy, if you will, because you're going to have a vowel on top of there, so it's going to be to another. It's going to be stuck to another word, so you're going to have a vowel on there. So usually it's an O, so it's oriphy, but raphy, and it's a suture, a stitch, if you will. Stitching something, it's a suture, and that suture is medical terminology, raphy. And plasty, surgical repair. The one that you'll run into a lot is arthroplasty, which is technically an arthroplasty is a joint repair, but in common usage, an arthroplasty is a joint replacement, right? If somebody has a total knee arthroplasty, it means they've had a total joint replacement. They go in and replace a knee with plastic. It's called an arthroplasty. And as people in the PT world, right, PTs and PTAs, we get heavily involved with rehabbing people who have had joint replacements or arthroplasty. Total hip arthroplasty, total knee arthroplasty, arthro being joint. So forming an opening or a mouth is stomy. Like an ostomy, like somebody who's had some intestinal issues and surgery and whatever. Sometimes they have a colostomy. So an opening or a mouth formed in their colon, and then they have a colostomy bag that they put on that opening so that the feces goes into the bag instead of out through the rectum, and so that's a stomy. Binding or fixation of a bone or a joint is a desis. So if it's of a bone or a joint, if it's of a joint, it's arthrodesis, right? Is a fixing of a joint, meaning fusing, basically. They'll go in and fuse it. So arthrodesis is fusing of a joint. So
That's like
pardon?
like arthroscopic surgery and stuff.
Arthro is joint. So arthroscopic surgery is, arthro refers to joint. Scopic means is referring to using a scope. IC is a IC and AL, and those suffixes are that's just referring to. So arthroscopic, using a scope, referring to using a scope to look at a joint is arthroscopic. Now, sometimes they'll do an arthrodesis arthroscopically, if you will. So instrument to cut is a tome. I think I talked about this the other day when we did the or sort of the rules of the game. I talked about an osteotome. I talked about computerized axial tomography, right? Tomography is it's like cutting you into slices when they do the X-ray picture, and that's a CAT scan, computerized axial tomography. The T of CAT scan, CAT is the T part of that acronym is tomogram, tomography. Tomogram is the picture. Tomography is the process. And then incision would be tomi, i.e. making a cut, right? So you see that these are from the same source, right? So a tome is an instrument, and tome is also refers to a text, right? If you will. Cuts to the heart of the matter, I guess. Incision is a tome, so ectomy, tonsillectomy, ectomy, EC, tomy, removal of by incision, right, or by cutting, ectomy. Right? We've talked about ectomies already, tonsillectomy, appendectomy, ectomy, right? Incision. The tomy part is the incision. Ectomy is removal by cutting, right? So diagnostic suffixes, right? Denote a procedure or a test performed, right? Or identify the cause and nature of an illness. So we've got electrocardiogram is a procedure. Gastroscopy is a procedure. And encephalography is a procedure. Graph and gram are similar. When to use which is sometimes confusing. So an instrument for examining is what? What's an instrument for examining things? What would you look through if you wanted to look at the moon or the stars in magnifying?
Oh.
Telescope.
Telescope, right? So a scope, an arthroscope, you look inside a joint. An endoscope, you look inside the abdominal cavity, right? Endoscope, right? So that's the instrument. The actual examination is scopy, like arthroscopy. So the scopy, right? So endoscopy, arthroscopy, so scopy. An instrument for recording is a graph, and the process of recording is graphy. So electrocardiograph is the recording, the actual strip that's printed out. The process of getting that strip is electrocardiography. So the electrocardiograph is the instrument for the for making the recording, and the process of doing it is echocardiography, or I'm sorry, electrocardiography. Echocardiography is another thing, but it's still the same. Correct. So if it's got a Y on it, it's the process of doing it, and if it's at the other ending, it's the instrument.
Dr. Jim,
Yep.
how soon will this be on Moodle to review this Zoom session?
How soon will what?
How soon will this Zoom session be available on Moodle for review to watch back?
The recording?
Yes.
Later today, maybe.
Okay.
I'll work on making it for later today.
No pressure. I was just curious.
Oh yeah, no pressure. Right? Sure.
No. I just realized that the PowerPoint is already on Moodle, right? Yeah.
Yeah, the PowerPoint's already on Moodle.
That's actually what I need more of. Yeah.
I just pulled it up off of Moodle. I go into Moodle and pop it open. I know, that's how I get to it.
Awesome.
I have it other places too, but that's how I get to it. So you are that guy, right?
I had to live up to it. Had to.
All right. So an instrument for measuring is a meter. The act of measuring is metry. And the record or writing is a gram. So if we go back a slide or two. So we've got a graph is the instrument and a gram is the thing that it puts out. And the process of doing it is graphy, right? So electrocardiography is the process. Electrocardiograph is the machine, and electrocardiogram is the actual printed out recording, right? A record. Does that make sense? Hopefully it's starting to make, hopefully it's starting to make a little sense. So the instrument is the meter, and metry is the active measuring, and the printed out thing is a gram. Of course, I could come up with examples of how that isn't true, but I'm not going to. No need to muddy the waters. So let's talk about pathologicals. Those were diagnostic suffixes, right? Examples of diagnostic suffixes. So now we're going to do pathological suffixes, like algiitis and this one, which I don't know how to pronounce without adding the connecting form. The word here is hemorrhage, right? Which means a flow of heme, which is blood. So hemorrhage is bleeding. Right? Itis, as we talked about, being inflammation. Algia is pain. So pain is what?
Algia.
Algia, right? So,
Is it algia or algia? Is it spelled algia? I would like that.
it's spelled out algia, but it's just algia. But yeah, algia. Or dynia. Dynia is ia, and this is algia. Yeah, I guess you could pronounce it algia. I typically say algia. What are painkillers called that you know, like aspirin? What's a broad category for that? They're often referred to as analgesics, right?
Oh, never.
Or you can have topical analgesics, you know, things like Bengay, or that you know, Aspercreme, or some of those things that you rub on things. Those are topical analgesics. Analgesics, right? That's the word root. An is without. Analgesic, without, referring to being without pain, right? Analgesic. The ick end instead of ia ending is referring to, right? So referring to pain, algic, analgesia, analgesic cream, analgesia, right? Or dynia. Formation or growth is plagia or plasm. Neoplasms are new growths, new plasm, new growth. Usually cancerous tumors, right? Neoplasm or neoplasia, the process of growing this new tissue. So plasia or plasm is growth.
Cytoplasm would be in that category too, right? I think it's a word, cytoplasm.
Cytoplasm. Cytoplasm is the stuff, the stuff inside a cell,
Okay.
where things grow. I think is probably where that comes from. So forming or producing of the origin, Genesis, first book of the Bible, right? Genesis, the origin of man, the origin of the universe. The first book of the Bible, Genesis, right? So the origin of something, Genesis. sometimes shortened to generic. Sort of its origins of something, referring to the origin of something. It's generic, if you will, in some ways. So anyway, Genesis, first book of the Bible, beginnings, the origins, bursting forth, right, or flowing, like hemorrhage. You have blood bursting forth. It's hemorrhage. So swelling is edema. Edema is a word on its own as well, not just a suffix. So, but it can be used as a suffix as well. We'll run across words where they do that, but it's a standalone word too. Is this something that you asked me the other day? Was it you, Edward, that said something about words standing alone that are sometimes suffixes?
No, it was just me. I was too much of a amateur because I didn't realize when you say a word, you just want the meaning. So it was my confusion. But if that's what I thought after I asked that.
Oh, okay. Okay. Well, there's an example of a suffix that's also a standalone word. Patient has edema, right? So, and it's probably more often used that way than used as a suffix. A hernia or a swelling is a seal. Swelling, yeah, protruding swelling is probably maybe. So some kind of a herniation is a seal.
Dr. Jim, how do you want us to differentiate edema versus seal?
Because seal is more of a herniation. So if it's it would be more of a protrusion. That's a swollen protrusion, if you will.
Okay.
And a lot of these things, unfortunately, are just going to have to be sort of distinguished by usage.
Okay.
Which we do in regular English all the time, but because we grew up with regular English and are used to that, we understand it and get it, or second nature to us, first nature to us. But sometimes you just have to. But seal is typically more often sort of a herniation as opposed to a regular swelling. And edema is more of a generalized term as opposed to a localized herniation. Again, by usage, you'll be able to determine once you get into this. So I would think of seal more in the herniation or hernia term as opposed to the swelling term. And edema, I think more of the swelling. A stone is a lith. We just kind of went through a lot of that. Or a calculus. Right?
Not math, right?
No, not math. And I don't know how that sort of, I always try to come up with I didn't do it with this one, I should have. I always try to come up with sort of the etymology of the word, the genesis of the word, right? Where did it come from? What's the original meaning and from the Greek or Latin or French or wherever it comes from. And I didn't do it with this. So I don't know how stone and calculus relate. We'll look it up at some point. But just understand a stone, like a kidney stone or a bladder stone or a gallstone, is a lith. Like cystolith would be a bladder stone, or a renalith, or this would be a kidney stone. Or gallbladder stone, gallstone would be. I just forgot the term for gallbladder. Sorry, that'll come to me eventually when it doesn't matter anymore in your music. So abnormal condition is an osis. Tendinosis, arthrosis. So tendinosis, a condition of the tendon. An inflammation of a tendon is a tendinitis. A condition of a tendon is a tendinosis. So osis is just a condition. And I don't necessarily buy the, used primarily with bone cells or blood cells. I mean, because I just used it for arthrosis for a joint and tendinosis for a tendon, and neither one of those are blood cells. So osis is used all the time. Don't necessarily buy into it primarily with blood cells. No, not necessarily. Hemarthrosis, the condition of having blood in a joint. Hemarthrosis, right? That's another. So an involuntary contraction is a spasm. A narrowing is or a stricture is a stenosis. Discharge or a flow is urea. If you look back, so, all right, bursting forth, right, is similar to discharge or flow, right? So if you add an AGE, it's a bursting forth, and if it's this is flow. So if you've got flow coming out your backside, what's it called?
Diarrhea.
Diarrhea, right? Nobody ever forgets this one, right? Diarrhea. Everybody remembers that because it's what we were more familiar with, right? Disease, pathy. So arthropathy, right? Disease of a joint.
Dr. Jim, stricture, that's just like a
I'm sorry?
for, stricture.
Stricture, a narrowing, a closing down of an opening, a clamping off, if you will, is a stricture. So, so stenosis. This is one that we as PTAs will run into when we're dealing with spinal problems, with the term spinal stenosis, and it has to do with a closing down of the neural canal or the neural foramina where the nerves come out from the spinal cord out to the periphery. So spinal stenosis is one that we run into a lot in our profession, our chosen profession. Disease is pathology, right? The study of disease is pathology. That's where this suffix is then a word root, patho, as the combining form, pathology, right? The study of disease, right? A pathologist, the guy that looks at biopsies that are taken and decides whether it's pathological, decides whether it's a disease, pathological, right? So patho is a combining form, path being a word root for disease, right? Although if you stick it on the end of something else, then it becomes a suffix meaning disease. So inflammation is itis, tumor is oma, like osteosarcoma, cancer of the bone, osteosarcoma, cancer of the bone tissue, sarc meaning tissue.
Itis.
Rupture, rhexis, and paralysis plegia, right? So if somebody's had a stroke, a CVA, they have hemiplegia, weakness or paralysis of half their body. Plegia is actually a paralysis. Paresis would be. So plegia is a paralysis. You're hemiplegic, you're paralyzed on half of your body because you've had a cerebrovascular accident, a stroke.
Or sleep paralysis.
Yeah, I haven't thought about that one. Narcoplegia, paralysis from sleep, narcoplegia. See, that's what you can do with medical terms, right? You can sort of make them up as you go along. Right? Narco is sleep. Narcotic is something that induces sleep. It's a narcotic, right? Roughly.
Yeah.
So narco is sleep. Narcolepsy is when you have a disease condition where you fall asleep, you know, at weird times and uncontrollable. Where you just boom, not dozing off when you're watching
Okay.
TV or something boring falling asleep during my class. That's not narcolepsy. Narcolepsy is a real condition where you actually fall asleep without, you know, just all of a sudden, boom, and you're asleep. Right? Narcolepsy. Right? Like epilepsy is a brain disorder, seizure disorder. Narcolepsy is sort of sleep seizures. So anyway, rhexis is a rupture. Yeah, it's a hard one to come up with an example until we get further down the road. Oma and itis, oma tumor itis inflammation. Plesia paralysis. So dilation or expansion ectasis. Again, tough to come up with an example real quick off the top of my head, but we'll come up with a few in a minute, I think. Emesis, vomiting. You know, those funky little kidney-shaped trays. If anybody of you have ever been in the hospital, and they have these funny little kidney-shaped, kidney-shaped trays that are called an emesis basin, right? It's a little tray that you're supposed to barf into, right? So emesis, vomiting. Emia, blood condition. Anemia, right? Anemia. People have heard of anemia, right? Oh, it's anemic. Something's anemic. It's lacking blood, if you will. Anemia means without blood, roughly. So
Bulimia, right?
bulimia. You got to come up with that one. Got to look that one up too. Bulimia, but yeah, that's emia would be blood. Bulimia. Emia in that term does refer to blood. I don't know quite why and how, but it does. Abnormal condition, iasis. Again, we'll come up with a example in just a minute. Grammatical suffixes ik, al, isian, and ia, right? Ik and al are adjectives, kind of meaning referring to, gastric referring to your stomach, neural referring to the nerves. Obstetrician is a guy who does obstetrics. Pneumonia is a condition of the lungs. Those are a little less problematic in terms of trying to remember and whatever. It's, you know, by usage you'll kind of grab hold of those. And diminutive, Ewell and arteriole. If you've studied cardiovascular stuff yet, you have arteries, and then the smaller arteries are arterioles, or you have big veins, right? And then you have littler veins, venules, right? Venules. A tubule is a little tube. Arteriole, little artery. So Ewell or Ole is arteriole is small. So adjective suffixes ak, al, are, eri, ik, il, us, and noun suffixes isis, ia, ism. So you know, if you want to, in recent days, we've heard a lot about Amy Coney Barrett. She's Catholic, right? Ik. That's an adjective referring to the fact that she is a person of the Catholic religion, not Catholic. Catholicism is the noun, right? the religion, Catholicism. So that makes that the noun ending. Catholic is a adjective ending. Pediatrician is a noun suffix, right? And ist, archaeologist is a noun because it's a person that studies archaeology. So no, you don't have to get too bent about these because you'll just learn to recognize it's not a problem. I'm not sure that it would be of great benefit to try to memorize those. Nouns, psychiatry, right? A noun. Psychiatry is the study of psychological things. Psychiatry. And Yule. We just talked about those. Yule. Those are small. So iatry, medicine or treatment, right? Right. Psychiatry. And if you understand psychiatry, it's a medical thing as opposed to psychology, which is sort of talking to people, and psychiatrists or physicians that are medical people that can prescribe medication. So singular and plural suffixes, again, by usage, you'll get kind of used to these. Bronchus, bronchi. Bronchus is singular, bronchi is plural. Diagnosis, diagnoses. Deformity, deformities. This is a standard one, right? This is typical English sort of formation of a plural. Change the Y to I and add ES, right? That I think we learned that in 5th grade English or something. So that's typical English. Bronchus to bronchi. And this slash mark is wrong here. Right? The slash mark is after the CH here. The slash mark should be after the CH here. Bronchus, bronchi. It's you change the US to an I. You don't change the US to CHI. Right? So the slash mark is in the wrong place. Diagnosis, diagnoses. So by usage, you'll get to understanding. So change the following to plurals. Thrombus. Give me an answer. Thrombus to what?
Thrombi.
Thrombi, right? Ovum to
Ovums.
Ova.
Ova.
yeah. I would have liked that one too, but it's actually ova. So fungus,
Fungi.
fungi, diagnosis,
Diagnoses.
diagnoses. So the only one we had problems with was ovum to ova. So crushing of a stone is a lithotripsy.
Tripsy.
Very good. Lithotripsy. Form a new opening or mouth is and your colon is a
Ostomy.
ostomy. Colonostomy. An excision or removal of an appendix is appendectomy.
Appendectomy.
Appendectomy. See, you guys know this stuff already. Disease of a joint,
Arthritis.
no, itis is an inflammation, right? Arthritis is the one commonly used. Somebody's got it right. Arthropathy. Yeah, remember pathy is disease, so disease of a joint is arthropathy. Instrument used to examine a joint.
Arthroscope.
Arthroscope, very good. Inflammation of the stomach is
Gastritis.
gastritis, right? Surgical puncture of a joint.
Uh,
I already used this one as an example. What's a joint?
Arthro.
Arthrocentesis,
Synthesis.
arthrocentesis. Very good. Very good. Arthrocentesis. There it is. See, you guys know this stuff already. Suture of a muscle is
Ref.
Myopathy?
Yeah.
Yeah, myopathy. Myo is muscle, right? Myopathy. Fixing of a joint or fusing, binding.
Arthrodesis.
Arthrodesis, right? Forming of an opening or mouth into the trachea.
Laryngostom.
Tracheotomy.
Laryngostom.
Sodomy.
Good.
Tracheostomy.
Tracheostomy.
Tracheostomy. Yeah, I can't pronounce it.
Usually you hear the term tracheotomy being used, but more correctly, it's a tracheostomy. Right? Tracheostomy. Instrument for recording heart is a cardiograph.
Graph, sorry.
Yeah, cardiograph. Right. So to record the record of the electrical activity of the heart is electrocardiogram. Electrocardiogram. And pain and nerve is
Neuralgia.
Exactly, neuralgia. Or neuralgia, if you want to be a little bit more pronunciation of all the vowels, but neuralgia is kind of the typical way it's said. Forming, producing, or the origin of cancer.
Carcinogenesis.
Carcinogenesis or carcinogen, right? Carcinogenic is that ick ending, right? Makes it more of an adjective. If gasoline is carcinogenic or cigarette smoke is carcinogenic, you've turned it into an adjective. But carcinogen is the noun, right? Cigarettes are a carcinogen, or the origin of your lung cancer, the carcinogenesis of your lung cancer was cigarettes, right? So carcinogenesis or carcinogen. Softening of bone, osteo. You haven't had this.
Porosis.
No, osteoporosis would be good, but and that's very true. But the term they're looking for here, which we didn't even go over yet, so I don't know why they throw it at you, but it's a term you're going to need to know. It's malacia, osteomalacia. Is a softening, malacia. Porosis technically means osteoporosis, porous bone, right? So the bone becomes more porous in osteoporosis. It's also a softening, but so an osteomalacia is a kind of a different condition. Abnormal condition of stones. Lithiasis, right? Lithiasis. So hernia or swelling of the liver is
edema,
hepatocele. This is your hernia. Seal, right? Hepatocele is you get a herniation in the liver. Or hepatomegaly, right? An enlarged liver. That goes with with what I was asking on the first day with by that guy, with swelling being an inflammation, right? So if you have hepatitis, right, inflammation of your liver, isn't that the same as hepatomegaly? Well, hepatocele is maybe the same as hepatomegaly, and so it all kind of comes back around full circle. But yeah, swelling of a lymph gland. Swelling is. This is where our edema is used, lymphedema, right? Lymphedema, swelling of a lymph gland. When in actuality, lymphedema is more edema caused by a lymph system, right? Or swelling caused by lymph, not necessarily a lymph gland, right? So this is probably not. Swelling caused by lymph would be lymphedema. Tumor composed of lymph tissue would be lymphoma. And bursting forth of blood, it would be a hemorrhage. And there you have it. Any questions? No quick questions? Any slow questions?
The instrument for recording is a graph, and then the process of using that. I know it's graphy, but it's the process, right, of using.
Yes, it's the process. Graphy is the process, right? I think that's what it said somewhere in one of our slides. Electrocardiograph is the machine. Electrocardiography is doing it. And electrocardiogram is the printed out thing.
Recording or writing of it.
Okay.
So Jim,
Yes.
could it be correctly understood that these PowerPoints can be used as training materials for directly an exam? Can I make that connection? If I want to prepare for the exam,
You can make that connection, but also make the connection that the language lab stuff is also
Okay.
part of it. I'll try to give you a study guide that gives you some word lists. But I typically try to follow the slides.
Thank you.
In terms of medical
Also-
language lab, I know some of you have had some problems, and I've gotten some emails. If you're still having problems, email me. But what I want to make sure you do, you're still seeing my screen, right?
Yes.
Yes.
Yeah.
What I want to make sure you do is go to homework A and homework B and follow those, because those will tell you how to get signed up in medical language lab. So if those don't answer your questions and you still have trouble getting into the medical language lab, then let me know.
Just to clarify as well, in regards to the medical language lab, you had said to don't submit it until you've gotten all the right answers. I was going through the first couple questions of it, and it makes you scroll through various questions and then you hit submit, but it didn't seem like it would save each group of questions. So I wasn't sure how the final submission gets uploaded.
I think
Maybe I
if you
missed
hit
that.
submit, if you hit submit, you may have already done it.
Okay.
I think there's a thing that says review or something.
Right. It says review answers, and then it takes you back to, or it shows you the reviewed answers, but then you can go back and type them in again. If it just seemed like once you hit submit one time, it didn't seem like it canceled you out. It seems like you could do it numerous times.
I think you
Maybe
can
I was
still
just
go. I think you can still go back and review, but once you hit submit, it's submitted for grading.
okay.
But if you just keep hitting review, you can keep going back and changing your answer until you're sure you have them all right, and then you hit submit, and then it submits for grading. But then you can go back and review for the sake of reviewing for your exams and things, so that you have that material, so it doesn't appear so that you can't, right?
I just wanted to make sure that they
you
was
can't
getting
look at it
saved
again.
at some point.
So make sure make sure don't hit submit until you've reviewed your answers enough times to make sure you have them all right. Because once you hit submit, it submits for grading, but it doesn't disappear because it wants it to be available for you to use it for studying.
Got it.
Okay. Any other questions? All right. I'll see you guys next week, right?
Yes, sir.
Yes.
Yeah.
Yes,
All
sir.
right.
Thank you.
All right.
Thank you.
All right.
You
Thank
have
you.
Have a good weekend. Study hard.
You too. Thanks.
Will
Have a
do.
good
Thank
weekend.
Study hard.
Alright.
You have anatomy to study for as well, right?
Yes. sir.
Yes.
That's the
And
hardest
don't-
class.
Don't get behind on memorizing that anatomy stuff, right?
Right.
All right. I often tell classes that there are certain things you just have to memorize, right? There's just no way around it. And a lot of the anatomy is that way. And what you're going to get into in biomechanics later down the road is movements. And you're going to need to know what muscles cause what movements. For example, your bicep, right? Bends your elbow, just as a quick example. So your bicep bends your elbow. If you memorize the bone and the attachments of the muscles on the bone, then when you think about movements later down the road and you have a real good solid knowledge and memory of where those muscles attach, all you have to do is remember that a muscle contracts, shortens, and it pulls the distal attachment closer to the proximal attachment. And so it makes that bone move in that direction. So it makes stuff down the road easier if you get a good, solid, memorized and learned anatomy where the muscles attach on those certain bones, right? Then it'll make it easier down the road. If you don't have that solidly ingrained in your brain, further down the road gets harder, because then you've got to try to remember the motion, and you won't have that solid background on where those muscles attach. And so you need to, so you're going to ultimately end up having to memorize it anyway. So it's best to just go ahead and get the real solid memory of, and it's, and there's no way around it, right? I mean, that's kind of the way it is. So, but the more you get it locked into your brain now, the easier things are down the road. Right? So, all righty, guys. Have a great weekend.
Appreciate
All
that.
right,
Thank you,
thank you,
Dr.
Dr.
Thank
I
you.
might, no, I don't think I get involved in your open lab. So anyway, all right. Have a great weekend. See you all
Thank
next
you.
week.
All
All right,
right, you.
Thanks.